Hello, everyone, and welcome back. Many English learners make one big mistake at the doctor.
They know basic words like doctor, medicine, and sick, but they can't explain their symptoms clearly.
And at the doctor, clear English is very important.
So today, we'll learn how to say what hurts, how long you felt this way, and what you should or must do next.
Simple words, useful phrases, real situations.
Let's begin.
Anna, I think going to the doctor in another language is one of the most stressful situations.
I agree. Because when you don't feel well, you already feel tired, nervous, or uncomfortable. And then you also need to explain everything in English.
Exactly. It's not like ordering coffee. If I order the wrong coffee, okay, sad morning. But if I explain my symptoms badly, that's more serious.
Right. So today, we'll keep everything simple and practical. We'll talk about making an appointment, explaining symptoms, saying how long you felt sick, understanding advice, and asking questions about medicine.
Good. Let's start from the beginning. Before I see a doctor, I often need to make an appointment.
Yes, an appointment is a planned time to see a doctor, dentist, or another specialist.
So I can say, I need to make an appointment.
Perfect. You can also say, I'd like to make an appointment with a doctor.
That sounds polite.
It is. And if you want to ask about time, you can say, do you have any appointments available today? Or, is there an appointment available tomorrow?
Available means free, right? Like a time that is possible.
Exactly. If a doctor has an available appointment, it means you can come at that time.
Let me try a small example. Hello, I'd like to make an appointment with a doctor. Do you have anything available today?
Very good. Natural and polite.
What if I don't know if my problem is serious?
You can say, I don't feel well, and I'd like to see a doctor. That's simple and clear.
Good. Now I arrive at the clinic. Clinic means the place where I see the doctor?
Yes, a clinic is a place where doctors see patients. A patient is the person who needs medical help.
So if I'm sick, I'm the patient.
Correct.
And then the doctor may ask, what seems to be the problem?
Exactly. This is a very common question.
That question sounds polite, but also a little scary.
It can feel scary, but it just means, what is wrong? Or, why are you here today?
So I need to explain my symptoms.
Yes, symptoms are the signs that show you are sick or unwell. For example, headache, fever, cough, sore throat, stomachache, runny nose, dizziness, tiredness, or pain.
Let's go slowly. If my head hurts, I say, I have a headache.
Correct.
If my stomach hurts, I say, I have a stomachache.
Yes. You can also say, my stomach hurts.
Which one is better?
Both are fine. I have a stomachache is very common, and my stomach hurts is simple and natural.
What about throat?
You can say, I have a sore throat. That means your throat hurts, especially when you swallow or speak.
So not, I have throat pain?
You can say that, but I have a sore throat sounds more natural.
Good. If I'm very hot and sick?
You can say, I have a fever.
And if I make this sound all day? Cough, cough.
Then you can say, I have a cough.
Easy.
If your nose is producing a lot of liquid, you can say, I have a runny nose.
Runny nose. Very strange phrase, but useful.
Very useful.
And if I feel like the room is moving?
You can say, I feel dizzy.
D-I-Z-Z-Y. Dizzy.
Exactly.
What if I just feel weak and tired?
You can say, I feel weak, or I feel very tired.
Okay. So I can say, I have a headache, I have a fever, and I feel weak.
Perfect. That is clear English.
But how do I say how long I've felt this way?
Good question. The doctor may ask, how long have you had these symptoms?
Symptoms again means the problems I feel in my body.
Yes. And you can answer with simple phrases. For example, since yesterday, for 2 days, for about a week, or since Monday.
So if my throat started hurting yesterday, I can say, I've had a sore throat since yesterday.
Excellent.
And if I had a cough for 3 days?
Say, I've had a cough for 3 days.
What's the difference between since and for?
Use since with a starting point, like since yesterday, since Monday, or since last night. Use for with a period of time, like for 2 days, for a week, or for 3 hours.
That is actually useful.
It is very useful at the doctor.
Let me try. I've had a fever since last night.
Perfect.
I've had a headache for 2 days.
Also perfect.
Nice. I sound like a responsible adult.
You do.
Now, what if I don't know the exact word? For example, I don't know dizzy.
Then describe it with simple English. You can say, I feel like I might fall, or the room feels like it is moving.
So I don't need perfect vocabulary. I can explain the feeling.
Exactly. Simple explanation is better than silence.
That's a good rule.
Now let's talk about pain. Pain is very common at the doctor.
Yes, pain is when something hurts.
Correct. You can say, I have pain in my back. I have pain in my chest. My arm hurts. Or, my knee hurts.
So body part plus hurts.
Yes, my back hurts. My neck hurts. My ear hurts. My tooth hurts.
That structure is super useful.
Very useful.
What if the doctor asks, is the pain strong?
You can say, it's mild. It's quite painful. Or, it's very painful.
Mild means not very strong.
Correct.
And quite painful means medium?
Usually, yes. It means the pain is noticeable and uncomfortable.
Okay, let's do a mini role play. You ask me what's wrong.
Great. What seems to be the problem?
I don't feel well. I have a sore throat and a headache.
How long have you had these symptoms?
I've had them since yesterday.
Very good. Clear and simple.
That already feels useful.
Now let's add advice with should.
Yes, grammar focus.
We use should for advice. It means something is a good idea.
For example, you should rest.
Exactly. Or, you should drink more water.
You should stay home.
Good. You should call a doctor if you feel worse.
That sounds important.
Yes, should gives advice, but it is not as strong as must.
So should is like, this is a good idea.
Exactly.
And must?
Must is stronger. It means something is very important or necessary.
Like, you must take this medicine twice a day.
Yes. Or, you must follow the doctor's instructions.
So must feels more serious.
Correct.
Let me compare. You should rest is advice. You must take this medicine is stronger instruction.
Exactly.
And if I don't understand the advice?
Then ask. You can say, could you repeat that, please? Or, could you explain that more simply?
That phrase is great. Could you explain that more simply?
Yes, very useful and polite.
What about medicine? There are many confusing words.
Let's keep it simple. Medicine is something you take to feel better. A tablet is a small, solid piece of medicine. Syrup is liquid medicine. A prescription is a paper or digital note from the doctor that allows you to get medicine from a pharmacy.
Pharmacy is where I buy medicine.
Correct.
And dose?
A dose is the amount of medicine you take at one time.
So if the doctor says, take 1 tablet twice a day, 1 tablet is the dose.
Yes, in that example, 1 tablet is the dose, and twice a day tells you how often to take it.
Twice a day means 2 times a day.
Correct.
Once a day means 1 time a day. 3 times a day means 3 times a day.
Exactly.
What should I ask if I'm confused about medicine?
You can ask, how often should I take it? Or, should I take it with food?
Very useful.
You can also ask, are there any side effects?
Side effects are problems that medicine can sometimes cause.
Correct.
And if I forget everything?
Ask, could you write it down, please?
That is a lifesaver.
Yes. At the doctor, it's completely okay to ask for written instructions.
Now let's talk about must again. I want to use it correctly.
Sure. Use must when the instruction is very important. For example, you must finish the full course of medicine if the doctor gives you that instruction. Or, you must come back if your symptoms get worse.
Get worse means become worse.
Correct.
And get better means improve.
Exactly.
So I can say, I'm not getting better, or my symptoms are getting worse.
Very useful phrases.
What if I need help quickly?
You can say, I need medical help, or I need to see a doctor today.
Clear and simple.
Yes. And if it is an emergency, you should contact emergency services in the country where you are.
Good. So for normal problems, I can make an appointment. For serious, urgent problems, I need emergency help.
Exactly.
Now, I want to practice a full doctor-style conversation, but still only with us.
Great. I'll ask common questions, and you answer as a patient.
Ready.
What seems to be the problem?
I don't feel well. I have a headache and a sore throat.
How long have you had these symptoms?
I've had them since yesterday.
Do you have a fever?
Yes, I think I have a fever.
Do you have a cough?
Yes, I have a small cough.
Are you taking any medicine?
No, not right now.
Very good. Natural and clear.
Could I also say, I took some medicine this morning?
Yes, that is very useful. I took some medicine this morning. Or, I took a tablet this morning.
Good.
And if you are allergic to something, you should say it clearly.
Allergic means my body reacts badly to something.
Correct. You can say, I'm allergic to this medicine, or I'm allergic to peanuts.
Important phrase.
Very important.
What if I don't know how to pronounce the medicine name?
Show the package or say, I don't know how to pronounce it, but I can show you.
That's natural.
Yes, you don't need perfect pronunciation in that situation.
Now, let's add more useful patient phrases.
Sure, you can say, I feel sick. I feel weak. I feel dizzy. I have pain here. It hurts when I move. Or, it hurts when I swallow.
It hurts when I swallow is useful for sore throat.
Exactly.
And it hurts when I move could be for back pain or knee pain.
Correct.
What if the pain comes and goes?
You can say, the pain comes and goes.
Nice phrase.
If it is always there, you can say, the pain is constant.
Constant means it doesn't stop.
Yes.
Again, very useful.
Now let's talk about doctor advice. The doctor might say, you should rest for a few days. You should drink more water. You should avoid heavy food. Or, you should come back if you don't feel better.
And stronger advice with must?
You must take this medicine twice a day. You must not take more than the recommended dose. And you must follow the instructions.
Good. But for the podcast, we're not giving real medical advice, right?
Correct. We are practicing English phrases. For real health problems, always follow advice from a qualified medical professional.
Let's do another mini practice, but with should and must.
Okay, I'll say a problem and you give advice.
Ready.
I have a sore throat.
You should drink warm tea and rest your voice.
Good English advice phrase.
I have a fever.
You should see a doctor if it gets worse.
Good.
The doctor gave me medicine.
You must follow the instructions.
Excellent.
So, should for helpful advice, must for very important instructions.
Exactly. Now, before we finish, let's review the most useful phrases naturally.
If you need an appointment, say, I'd like to make an appointment with a doctor.
If you need to explain symptoms, say, I have a headache. I have a sore throat. I have a fever. Or, I feel dizzy.
If the doctor asks how long, say, since yesterday, for 2 days, or for about a week.
If you don't understand, say, could you repeat that, please? Or, could you explain that more simply?
If you get medicine, ask, how often should I take it? Should I take it with food? And are there any side effects?
And remember the grammar. Should is for advice, and must is for something very important or necessary.
Now we have a speaking challenge for you.
Write one sentence in the comments using today's health English.
For example, I have a headache, I feel dizzy, or you should drink more water.
Or write one sentence with must, like, you must follow the doctor's instructions.
And tell us, what health word is difficult for you to remember in English?
We'll read your answers and maybe use some of them in a future episode.
Thanks for listening. Doctor visits in English can feel stressful, but you can handle them step by step.
Learn the key phrases, speak clearly, and ask questions when you don't understand.
See you in the next episode.
Take care.
Bye, everyone.
Bye-bye.